It's a hugely transformative procedure from before to after, and just giving our patient back lots of confidence. Our patients will always tell us it's the best thing they've ever done. Hi, I'm Dr. Peter Doherty, one of the dentists here at 3Dental, and I would like to show you a case study of one of my patients that we did the All-on-6 dental implant procedure for. And it takes you from the start of his treatment right to the very end, gives you an overview of what's involved in the process. This particular gentleman came to see me and he had problems with gum disease. What you'll see is this large gap in between his two front teeth, which wasn't always there, developed over the last few years as the teeth began to spread and move apart. Down on the bottom, you can probably make out the fact that there's lots of plaque and tartar here, and the reason is because those teeth are loose, so they've had gum problems, they're moving, they're loose and they're sore, so it's very hard for the patient to brush those teeth, and then he ends up in a vicious cycle. So the teeth are sore, so you don't brush them, more plaque and tartar builds up, the gum disease becomes worse, the gum and bone is lost even more, the teeth become more loose and more sore, and it just becomes a descending spiral, until such time as the teeth are not fixable. And then a patient will come to see me and say, look, what can we do here? In this case, we did an examination, we did a 3D CT scan and determined the teeth were not fixable and we had to remove them and that implants were suitable. So what we opted for here in this situation was All-on-6 on the upper and All-on-4 on the lower. And the reason for that is because this gentleman was a big man, powerful jaws, lots of forces in there, and he was relatively young for this treatment also. So what we wanted to do on the top, where the bone is less dense than it is on the bottom, to provide a procedure or a treatment that would last for a long time into the future. And that was All-on-6. It was most suitable for him. The next image shows you after the surgery. So we've done our surgery, our temporary bridge has been in place for a period of 3 months. And then this is the result. This is us looking at the top jaw, and you'll see we have 1, 2, 3, 4, 5, 6 implants. These are the gums that used to hold the teeth, and the lip is up here, it's been retracted, and this is the palate. That's what it looks like underneath the bridge. And then on the lower, I'll just show you the lower for the sake of it, because this is an All-on-4 on the lower. So this is the lower jaw. Again, this is the tongue, this is the floor of the mouth, and this is the gums where the teeth would have been at one stage, and we have 4 implants there. In the bottom jaw, in this case, it was possible to do just 4 implants because we could get our back implants back really far, and the bone was very dense on the bottom. It's a very strong bone. We didn't need to use 6 implants. When we take an X-ray of that, this is what it looks like. So we've got 6 implants across the top. The 2 at the back are tilted, and the reason they're tilted is because we have this anatomy here, which is the sinus, and the sinus is an empty air space. It happens on both sides. It's over here as well. So we can't put implants in here. There's just nothing to hold them. So we put them as far back as we can, and then we have a small portion of the bridge that's cantilevered or hanging out in space here and here. On the lower, it's a different story. We could get our back implants back very far here and here. So we didn't need to do any cantilevers, and we just have a straight routine All-on-4 there. Our next image then, this is our final bridge. So you're looking at the bridge from the biting surface, and there are 6 holes here. So the bridge is made of 2 materials. One of them is zirconia, which you can see from this side, and it's a porcelain. And just in the holes, you get a hint of the other material, which is a metal material, titanium. And if you flip the bridge over, this is what it looks like from the front. Again, we have our zirconia teeth, and in underneath we have a metal framework. And this metal framework is milled, and it's milled to specifically fit over the tops of the implants really, really accurately. The undersurface also is convex. You see it here, it's convex, so it's cleansable. There's no food going to get trapped underneath here, because when it sits into the gum, it pushes in like a bullet and provides pressure in that area, which helps to keep it clean. And then if you look right from the top, you get another appreciation of how it looks. Again, our 6 implants based in titanium, and then with the zirconia wraparound. When we put that in the mouth and lift the lip back, this is what it looks like. So there's a joint here between, I suppose, our fake gum and our real gum. And this is the area that the patient needs to be very careful about to keep it clean. And from the undersurface, if you look at it from the palate side, again, we got the palate here. The holes for our implants, they've been sealed over. So, once the bridge is in position and screwed in, we just seal it over with a filling material so nothing can get into those holes. And then the next view is of the patient biting together. So these are the top and bottom teeth in position as the patient bites. And our last image of all is the smile. So this is our after photograph. Again, it's a hugely transformative procedure from before to after. We've improved on aesthetics, on the ability to bite and chew food, and just giving our patient back lots of confidence. If you're interested in this procedure, All-on-6, then you can find our details on our website, 3dental.ie, and we'll arrange a free consult for you, talk you through your options and let you know what can be done for you. We offer free consultations, payment plans, and also finance to make this treatment as accessible as possible for you. A really life-changing procedure. Our patients will always tell us it's the best thing they've ever done. You know, they're so delighted they've done it, and their only regret is that they didn't do it sooner. That's what I find.